Hey everyone, thank you so much for waiting. Hi, so this is Padma Priya. I'm the editor of Suno India. Suno India is an independent podcast platform for social issues. And we have a range of shows on very, very different underreported issues. Um, and this is part of our podcast series called Cyber Democracy, which is produced by Suno India and is supported by the Internet Freedom Foundation. We are here today to sort of discuss the growing amount of how do you say, that there's been like a sharp increase in technology for solutions because of the pandemic. And it seems like the unprecedented nature of the pandemic itself is being used as some sort of a justification to launch and also use certain surveillance apps which seem intrusive. And this is not just happening in India, but by countries across the world. The Indian government recently launched and is aggressively pushing for Arogya Setu app. And they're saying that could be an effective solution to combat COVID-19. So we thought we'll sort of have a discussion with our panelists today to talk about what are the ethical sort of constraints with regards to technology and health. Um, is there like any potential of misuse of the information that is being collected? But most importantly, because the term contact tracing and disease surveillance is being thrown around, we also thought it to be extremely important to have a doctor and a health professional sort of take us through what exactly is health surveillance. When you talk about surveillance from a disease point of view, what does that mean? And how is it different from surveillance, which is carried out by, say, police and intelligence agencies? So before we begin, just a few things. You can leave your questions in the public chat forum. We will take questions at the end of this discussion. So we have here with us today Dr. Sonali Ved. She's a, sorry, hello?
Yeah, hi.
Yeah.
Hi,
Yeah.
Pujman. Yeah.
Hi. So Dr. Sonali Ved is a doctor and she's a public health professional. We also have with us Siddharth Deb, who is the Policy and Parliamentary Counsel for Internet Freedom Foundation, and Srinivas Kodali, who's an interdisciplinary researcher, and he works on data governance and internet, and also the host of Cyber Democracy podcast. So a big welcome to all of you, and thank you for doing this. I would like to perhaps start with Sonali first. Sonali, we hear a lot of conversation, and contact tracing seems to have become the new favorite phrase for a lot of the people now, especially when they're also talking about Arogya Setu. Can you tell us what contact tracing means, and how do you, like, who does it? How are people trained to look into this? Um, and what are some of the added layers of complexity when it comes to contact tracing, when it comes to a pandemic like this, and with a virus where there is so much unknown?
So I'm going to begin with a disclaimer. So public health is very vast, and things like surveillance, contact tracing, they come under the domain of epidemiology. And everybody who's trained in public health does do some epidemiology. And then there are some who go on to specialize in the study of patterns of disease outbreaks, and things like epidemics, pandemics, outbreak investigations, and these are epidemiologists. So I don't claim to be one. So basically, whenever there is a disease outbreak, there are different methods. So let me go back to surveillance first. So surveillance comes from a French word, which means to watch over. So not watch over in the sense of Big Brother, where I would interpret it as catching hold of people who have done something wrong. In public health, the purpose is to help people. So in public health surveillance, the objective is to be of service to people, to save lives, to reduce disease. It is not to criminalize, ideally, not to criminalize and not to arrest and to detain and do all those things, but to understand how disease is spreading and how to protect people. So the very direction towards which public health surveillance surveillance is aimed is very different from, other kinds of law enforcement type of surveillance things. And in surveillance, in disease surveillance, and when I'm using surveillance, I'm talking from a public health perspective, we don't need to monitor everything. There are certain diseases which the health departments mandate, which need to be monitored. And so in India, we have the Integrated Disease Surveillance Program, and they have a list of diseases which have to be reported. And when we talk about surveillance, there is active surveillance, which means when the information is actively sought by the health department, they will contact the districts, the health facilities, and say, can you tell us if you have seen this and how many cases of this you have seen? And then there is passive surveillance. So there are certain diseases that are automatically notifiable. So things like cholera, typhoid, any cases of a type of paralysis, which is seen in polio. So all of these have to be reported mandatorily, even things like dog bites, snake bites. So this is passive surveillance. It's just continuously part of the program. Then you have seasonal surveillance, so things like influenza-like syndromes, you don't have to do it throughout the year. When it's the season, you're required to report. I hope I'm not getting too technical. And then there is something called syndromic surveillance, which means you're not reporting a particular disease, but you see a certain type of clinical picture, a certain group of symptoms. And if you see those, you're supposed to report them. And then there's also anything that is unusual, which does not come in a regular clinical picture, is supposed to be reported. And that's how something like a new virus or a new epidemic is initially detected, because some clinicians will notice that they're seeing something which they haven't previously seen. So surveillance systems, public health surveillance systems are prevalent throughout the world. They're all the time present there. Contact tracing comes into play when a disease outbreak is reported. Say, for example, there's a cholera outbreak. So you want to go and figure out where did it begin. And it's very unglamorous. It's a group of people. I'm not really sure what is being done currently in COVID, but usually it would be set up by somebody with some epidemiological experience, maybe not necessarily fully trained in epidemiology, but would have some prior experience. There would usually be a community member to build trust. So you will hear me saying a lot about trust. There could be district administration plays a major role. Local administration plays a role. It's not just the health departments. And we may need some level of, police personnel also present, especially in the current situation where trust is negative. So you would have, and then we are also including ASHA workers and other types of health workers who do contact tracing, which can become an issue because then there are other jobs, other activities, regular health programs suffer. So you have this team which goes which first identifies an index case, and then they go ask that person to list out and to remember who all they've been in contact with, and then they will go and contact each of those people. And so it's unglamorous. It is filling forms. There is probably some digitalization now. And it is basically door-to-door, knocking on doors. There are also other ways, which are telephone. So you could also do telephonic contact tracing if you want to avoid door-to-door if it's too much. So that's about it. So that's how contact tracing would work.
Right.
Yeah.
Could you tell us, in a situation that we are in today, what are some of the, and I'm talking at the ground level, because I think it's important for us to also realize that beyond technology, there is so much happening at the ground level, and public health is a lot about being ground up than being top down. So in that scenario, when there are, say, asymptomatic carriers of disease, like it seems to be the case with COVID, what is then the added sort of challenge and nuance there when it comes to contact tracing? And could an app help sort of I don't know, fill some sort of a gap here?
So I think applications are here to stay. I don't know, they're already, I don't know how many, 50 million, 10 million downloads of this app. It will stay, it will be used. I think there is some utility. You can have some automated system. You can enter your symptoms and they can tell you if you're high risk, low risk, and you should contact somebody. So I think technology has its place and its use, but it is not a replacement. And we have to be very, very careful about what are the risks and what are the possible harms of a technology solution. My personal designing apps do not have foundation or team members who have backgrounds in public health, in ethics, or being grounded in principles of confidentiality, ethics, patient privacy, and things like that.
Right. I would like to bring in Siddharth now, Siddharth of Internet Freedom Foundation. One of you have been working a lot in terms of the privacy implications of these Corona apps that are coming up, and IFF has also raised certain concerns regarding this. Uh, can you tell us what are some of your concerns?
Sure. So the concerns, I suppose, and can be divided largely into two buckets. I would say one is, of course, legal and institutional, and the second is, of course, the design of the app itself. Now, coming to something like the proliferation of apps that we're seeing, not just with the Arogya Setu app, but like state level apps as well, is the fact that there is no consistency. It's essentially an example of technological solutionism. So what I mean by that is the fact that quickly states and the center are coming out with these solutions without really any sort of discourse on the checks and balances and safeguards that must be integrated. Now that all of that stems from the fact that India lacks a cohesive legal framework to regulate government's ability to restrict people's personal privacy when it is in fact necessary in a democratic society. Now, without getting lost in the legalese per se, when it comes to any sort of restriction to the right to privacy, uh, you need to a government has an onus even in emergency situation to satisfy certain thresholds. The first is that any sort of activity which restricts people's personal privacy must be in accordance with an actual legal regime, uh, where there are clearly defined provisions which state that it is under these conditions that a restriction can take place to someone's right to privacy. That in itself is missing within India, and that by default, sort of we're stuck in a paradigm where India is uniquely disadvantaged. Now, on top of that, even when you have a legal regime, let's say in this case we don't have one, there is a heightened onus on the government of India, I would say, to justify any restriction to the right to privacy based on certain principles of necessity and proportionality. Now, before I get into that, when it comes to like responding to a public health crisis itself, our Supreme Court has said that yes, you can use people's health records and related information to respond to a public emergency or a health crisis like the coronavirus. But nevertheless, there is an onus on the state that when it's making these restrictions to people's personal privacy, uh, uh, the state must nevertheless protect people's anonymity. So that is a first level obligation on the state, which a lot of these government apps are not satisfactorily doing in itself. Now, at a second, deeper layer of analysis, we need to look at necessity. So, when you're looking at necessity, you need to look at it at two levels. First is any sort of purpose which is legitimate or necessary in a democratic society. There, protecting public health during a crisis fits. But then there's a second layer of necessity where you have to show that this particular type of intrusion into someone's personal privacy will actually be efficacious or effective to a government response to a necessary or an emergency situation. Now, with a lot of these government apps, uh, or most of these government apps, they've just been deployed without any actual empirical justification of the necessity threshold, which is that you're trying to show that this solution that we're building is actually going to effectively respond to the public health crisis at hand. Now that in itself is a difficult thing for most of these contact tracing apps or any of these apps to justify, because at the end of the day, contact tracing, even globally speaking, is an experimental technology. So, for instance, in other democratic societies like in Europe, before even getting into the actual building of the software or the underlying systems, they're having a dialogue as to how can we inbuild safeguards before you even start building the systems. So, for instance, the European Parliament is saying that before you start building any application or underlying system to use technology to respond to the coronavirus, you have to buy uh, to be able to align that with people's right to privacy. You have to be able to satisfactorily justify a proof of concept. That proof of concept must show that your technological intervention, like an app, is actually efficacious based on available data that can model the possible success scenarios, and then at a second level, once you establish necessity, you need to satisfy proportionality. Now, what that means in a nutshell is you need to be able to show to the public that if there are these different alternatives that you have to responding with technology or with an intervention which restricts privacy but is still responding to the public health crisis at hand, that in itself is proportionate or the least restrictive measure that you've chosen. So there is an onus to show that, look, we've considered these 3, 4 alternatives, and then this is the least restrictive measure. Now, when you even look at the way that the government has gone about, let's say the Arogya Setu app, it's sort of putting the cart before the horse. Now, what I mean by that is they've already, in a very short period of time, rolled out the app. Let's say it started development
Yeah.
19th 20th March. By April 2nd it was deployed. Now, in comparison, on April 2nd or 3rd they came out with a notification saying that we set up a government committee towards building a citizen app to respond to the coronavirus. Now, shouldn't it logically flow that first you set up the committee analyzes the situation and then determines what the technological response is? So that just linking those facts together in itself tells you that there is a consideration within government to expand the scope or the capabilities of this Arogya Setu application. And that in itself contradicts what is known as the principle of purpose limitation, and that's sort of embedded or intrinsically linked to the proportionality principle. Now, in all of that, another layer or challenge that India faces with any sort of attempt by government to restrict people's informational privacy is that we don't have robust institutions to hold each other accountable. So the
Yeah.
fact is that ideally there should be independent oversight mechanisms that can be able where the government has to periodically justify, look, we're satisfying the proportionality threshold and we're also, by the way, being effective in terms of the deployment of the technology. And then that oversight mechanism should ideally be able to tell the government, make an independent decision, and based on that whether you continue deploying a particular solution or not. Now, that is the broad legal challenge with it. And as we have our conversation, we can get into
Sure.
the specifics with respect to the apps itself. Uh, I was just curious, maybe Dr. Ved can answer a particular doubt of mine, is that when it comes to something like the integrated disease surveillance program, and based on my legal analysis of it, I was just curious, what are the sort of privacy safeguards that one needs to embed when you're trying to undertake disease surveillance so that people's informational privacy or their personal details are protected as best as possible?
So I can't speak specifically about the IDSP, but and Sonali is fine. So, but generally we talk of personal identifiers, um, And so that would be something like, I think, when you talk about anonymization. So I think when the records are entered for certain diseases where you may need an outbreak investigation, you would need to enter the names and other details of the patient. Uh, but for certain things, you would just need number of deaths, etc. So the information will go into the system, but then what are we doing with it? So in the current scenario, what are we doing? We are stamping people's hands. We are putting posters outside people's doors. And initially, for many people, in public health in India, the conversation was, this is unthinkable. Why people being stamped? And in fact, but now that seems a little harmless compared to where we've moved so far, within a span of like a month and a half, 2 months, that stamping hand seems like a lesser evil than, an app which has been downloaded by 50 million, 50, I don't know what's the latest number, unsuspecting people. And, for all I know, it may be harmless, but I don't know,
I think
and yeah.
I would actually like to bring in Srinivas at this point, because Srinivas is someone who works a lot in privacy. Srinivas, the Arogya Setu app and the other apps that are coming around COVID, being put out by, say, different state governments, the authorities are using location tracking on phones to identify, say, these COVID cases where they are. What does this mean in terms of our digital rights? And are we at some level, you know, are we actually like really compromising our privacy for inconvenience? And at what level do you think the compromise has now happened in India vis-a-vis these apps?
Okay, so the issue with privacy is it's potential harm that you can get, right? It's not necessarily that your information is out there. It's okay sometimes, but the issue is whether that information being out, whether that information being collected from you is going to harm you in ways that you can't imagine. And we've seen that even without information being out, during any crisis, like any emergency, not necessarily healthcare, people panic. And what people do during these panic situations is something no one can predict. Humans can't be predicted. Now, during this whole crisis, we have seen that all the data that was collected from people who have landed from abroad, who have come back, people who were known to be quarantined by the state, have somehow leaked to the resident welfare associations, right? So nobody knows how the data has come, but you suddenly have citizen polices, armchair epidemiologists or armchair doctors who are going and policing people, locking them up, and not necessarily harming them directly, but they are causing them quite a bit of trouble. And it's not, privacy is not always about informational, right? It's, we don't know how it is. I mean, even when the Supreme Court defined it, part of the judgment, it was very abstract, right? So when it comes to our rights, it's it's a very complex situation. People who are building some of these solutions, people who are, whether it's doctors, whether it's epidemiologists, or even the IT companies and volunteers, so-called startups who are building these apps, really do not understand it. And there is a reason why this is happening, because we do not actually have a framework or a law which says that, oh, these things are allowed. Even during an emergency, I will allow certain forms of data collection, right? And within the scope that these particular individuals will have access to it, they will be used for only this purpose. Now, what we are witnessing here is that you have the police providing healthcare response, right? Like, it's not necessarily the doctors who are doing it. Well, the mandate for police is completely different. When you give police information, the first thing they do is they'll find out everything about this person. and they will try to analyze if this person is someone who should be put inside a jail. That's their thinking, and that's what they've been trained to. That's not what doctors do. Doctors try to understand who the person is and whether that person needs care and what form of care, based on their personal data, their age, their gender, which is very important for doctors, healthcare professionals to know who these people are. So data in itself being collected is not always wrong, and privacy in a very abstract sense uh, can't be explained. But it's important that the government defines those regulatory frameworks. Even now, the government's bringing ordinances, rules, and acts saying that, oh, we got the Epidemics Act, we're going to do for a bunch of things. But nowhere it has even brought the basic privacy regulations that we were supposed to get 3 years ago when the Supreme Court judgment on privacy has come.
I want to bring in Dr. Sonali here because of a point that Srinivas just very briefly touched upon. Uh, do you think a pandemic like this changes the fundamental nature of the relationship between, say, a doctor and a patient? And does, say, a public health official sitting in a director or a department of public health now have more say in, say, okay, we will reveal certain details about this patient, and this is the reason why we're doing it? So do you think that fundamental nature has in itself changed? And is this how it is during pandemics? You're muted. 1 second.
So I think there are changes. I can't comment on whether it's a very fundamental change or something that's lasting or not. There is a change in the sense of, again, the trust and the fear issue. You know, is this patient telling me their right travel history? Is this patient telling me their contact history? And there are reports from clinicians that people are not disclosing because there's so much stigma and discrimination that has become attached to this. Plus, patients are also now afraid that if they tell their history correctly, will they get the medical care they need for the condition that they have come, right? So if I've come for a fractured arm, will I get to see an orthopedic doctor if I tell them that I live in a certain locality, which is a hotspot, right? So there is an issue of mistrust on both sides. There have been cases of neighbors discouraging people from going to the hospital because they're afraid that the person goes and something happens and then the whole area is put under quarantine. So there are a lot of these dynamics playing out, which we still do not fully understand. You know, this is not a linear system. This is a very complex, dynamic social system in play right now. And we don't fully understand the complexities of it. There are definitely changes. Both patients and health workers, nurses, we must consider nurses. They are the most exposed. Dynamics are changing. There needs to be much, much more effort on rebuilding trust than on making it a technology issue. It is not a technology issue, it is a social issue. And this is something that we have forgotten again and again, even in history. If we think about the term technology more broadly, we think of it as scientific application towards something practical, you know, to help society or whatever. And right now we're very technology focused. So we are thinking about a vaccine, we are thinking about ventilators, we are thinking about apps. All of these are technologies, right? We are not talking enough about the social system and its interplay and the socioeconomic interplay. Equity, we haven't talked about equity, right? How many people have smartphones? India has one of the worst gender divides on smartphone, on mobile access. Let's not even talk about smartphones. I think around less than 40% of women have access to even a mobile phone. That too, it is borrowed in a lot of cases. And even if they have it, their ability to do even slightly complex tasks like sending an SMS or using Facebook is much less than the than the equal ability for men. So I drifted a little away from your question, but we really need to think about issues of equity, social issues, gender issues when dealing with this whole dynamic. It is not a technology problem. There is no one ring to rule them all. It is not an something that's amenable to one app.
Yeah. I want to make a quick jump to Siddharth from this very important point that Sonali has raised. One of the things that we are seeing quite a bit, whether it is COVID or not, is that there seems to be a lot of technology, push for technology solutions, and we're seeing this more instead of say a healthcare response. Um, and like you said, there have been many important steps that are being missed even before the apps are sent out into the public, whether it is in terms of assessment and everything. Why do you think we as a nation are moving more towards a technology first solution for every problem that we seem to have, whether it is distribution of food, distribution of ration, or now in COVID? Why do you think we have become this nation of let's bring in more technology?
That's a very good question, and I think one way to like just think about it is, okay, I'm going to break down technology into two streams. One is information and communication technologies, where data and so on is involved, and then of course there are technologies that Dr. Sonali was referring to, like say the development of a vaccine. Now, if you wanted to just juxtapose these two paradigms, there is clearly in one regard the world is intimately becoming familiar with, let's say, the timeline for vaccine discovery and eventual deployment to market, and mostly people are agreeing that it will take around 18 months, and then we can think about it reaching market or meeting demand over a much longer horizon. But 18 months till it hits the market. Now, why is it going to take that long? Is because in this discipline, which is biomedicine, there are a number of checks and balances which have been inbuilt through regulation and laws itself to ensure quality assurance. Then, of course, there are ethical considerations with respect to trials and testing and so on and so forth to ensure that whatever that product is that hits the market, it ensures certain safeguards essentially in the process and the actual eventual product. Now, that sort of ethos is also there in a suite of other sectors and disciplines, like, let's say, automobile manufacturing. Again, there are a number of checks and balances that any developer must comply with. You can even think of it in the context of social science disciplines like psychology as well, where you need to, like, before you administer a study, you need to be able to satisfy your proposal against an ethics board, let's say. Now, in contrast, technology or information communication technologies are dealing in a are operating in a minefield where there is a great degree of immaturity when it comes to embedding safeguards, checks and balances with respect to privacy, ethics, etc., from the design stage itself, which is why it is so easy for, let's say, the government of India to build out the Arogya Setu app, and within 13 days, it's already hit and available for download on the Play Store itself. Now, basically, without those checks and balances, it becomes a lot easier for technological solutionism from a framework perspective. Now, from an optics perspective, if a government were to think, if we were to just dial back to, like, let's say 3-4 weeks ago, as to which were the most effective countries being marketed as, oh, these countries did well in terms of, even after the initial outbreak, they contained the spread, and the answers were Taiwan, China, South Korea, and Singapore. And those countries have deployed a suite or a bouquet of responses, right? And they aren't just technological. It is testing, aggressively increasing capacity with respect to hospital beds, PPEs, and so on and so forth. There are, let's say, 5 options. But which one? And therefore, a government bureaucrat, and if we just put ourselves in their shoes, they will try to see, okay, what can India replicate? Well, the rest of them are really hard to replicate, whereas this building of the technology in a timely and speedy manner is something that we can do. And on top of that, the metrics for growth are easy to measure, because then you can say, oh, there are 50 million downloads, 60 million downloads, 70 million downloads. It's a measure of progress, quote unquote. But whether it's effective or not, that sort of gets lost somewhere or gets muddled up in the political narrative. But from an optics standpoint, I would say that it's just easier to deploy, and then you can show to the public that, look, progress is being made. Whether progress or actual effectiveness with respect to responding to the coronavirus itself is happening, it's not something I don't think even the government can really answer at this stage, because it won't have enough data to back that up. Similarly, for instance, the Singapore app, the Trace Together app, which was deployed a few weeks ago, of course, there are certain very interesting things about the technological deployment itself. But there was a recent report this week that actual uptake by Singaporean citizens has been modest at best, and even the Singapore government does not have enough information as to whether it's being successful. So an alternative would have been, okay, if we're looking at the coronavirus being something that the world has to deal with over a period of a couple of years minimum, then, and you have set out a committee which is there for 3 months to be able to come out with its findings, at the very least that process should be transparent, and then whether you use a technology or not should come subsequent to the process itself. I think that's a short way to like sort of look at why governments are doing this. And of course, the broader answer is again, and Srinivas sort of alluded to it in his answer as well, is the fact that unlike countries like even the US, which has the Government Privacy Act of 1974, there is no legal mechanism to hold either the central government or state level governments accountable as such. There is no legal measure which will say, okay, this is how you develop and then deploy an app or a technological system. In fact, there is a lot of convenience and flexibility given, and the narrative is that you need that flexibility to be able to scale solutions. But when you're given that flexibility, if there are certain harms that accrue as a result, rolling it back becomes a lot harder later. And the thing is, people will say no, but what are the harms? But the thing is, you have to just keep in mind that when we're dealing with ICTs or information communication technologies, they're intrinsically linked with people's civil rights, and they're a suite of civil rights. So therefore, there's in fact a heightened onus to be able to do this in a manner either in compliance with the law, or alternatively with enough safeguards and transparency and assurances made to the public that the government will not abuse this unfettered power. And that sort of links back to what Dr. Sonali was talking about, which is the issue of trust. And that is something which is, I feel, missing at this stage. And rather, the government and other powerful actors may think about it as, okay, to push adoption and usage of these systems, we may have to go through the route of coercion instead. I'll
Yeah.
sort of pause my answer there.
Srinivas, I just want to take a moment to sort of ask you a question, pivoting from what Siddharth was just telling us. Um, with regards to these apps, do we have any clarity right now in terms of what is the information that is being collected? How will it be stored? What information the government will have access to in terms of data? And finally, say I download the Arogya Setu app today and then tomorrow I decide to take it off. What then happens to the data? And are there like any sort of ground rules as to, okay, this app will only be used for X purpose for the government? Because for me, coming from a point of trust, that will be a concern for me in terms of privacy.
Okay, so nobody knows what happens to the data. Once you give your data, right? Nobody knows where, to whom it's shared, what server it is in, who is using it, for what purpose he is using it. And there are no limitations on this, right? Like without a lack of data, everybody is like, oh, we can do whatever we want. It's an emergency. As I've been saying, that there are departments who are publishing it. So clearly, it's clear to us that people, once the data goes out of their hands, nobody can have any control. especially in regards to most of these apps, like especially Arogya Setu, they claim they're not collecting the entire data and storing it locally, but then they also say they're collecting some form of it. We're not sure what exactly they're collecting. There are weird terms and conditions which say that we might be storing this data or using this data for various other legal purposes if the law permits us to do so. Now, all of this is really vague. And remember, this crisis has come during a moment when there was a deep mistrust in any government data collection exercise. Like until February, we had issues, protests going on in the country against the collection of census that was going to happen from April, right? And government had to stop it because of the pandemic. Now, how do you actually, so the whole reason you bring in computers is to bring trust that humans are corrupted, humans can be corrupted, that you can't trust humans. So why don't you trust a machine? And to make you trust the machine, they essentially tell you that look, this machine is programmed to work in a certain way, and this is the program. So you can verify whether this machine is working according to the program. But unfortunately, the source code is not open, right? So you don't know how the machine works. When you don't know how the machine works, you really can't trust the machine if the machine's being programmed to do something else. That brings me to one question. I think Siddharth just mentioned this in terms of anonymization of data. So in computing terms, when you want to bring trust in machines, what you do is you start using cryptography. You start using ciphers, essentially algorithms and prime numbers, which will help you verify that you are that person whom you claim to be. And you can create that end-to-end encryption and all of that, that essentially which could be verified. And apps which are being built in Singapore, for example, their contact tracing apps use some of these crypto solutions to anonymize the user's identity. So your data, when you come in contact with some other person with the same app, with the Bluetooth exchanging details, it doesn't really exchange your phone numbers or your details. It exchanges a cryptographic key. Okay. I think the Arogya Setu app also attempted to do something like that. Well, we can't really verify what they're saying because, again, the source code is not public. But Siddharth, if he has more views on it, please. I think you did put some of these in your report.
So, with respect to the different technological specifications that you're referring to, and it's a great point that we can't really verify a lot of things about the app, especially in the back end, because there is no adherence to a core principle of transparency, which also engenders trust, you know. So, for instance, the Singapore effort has published the entire source code of their underlying protocol of the Trace Together app, which is the Blue Trace protocol. Now, alternatively, if you look at even, let's say, a private sector effort by Google and Apple, now they haven't rolled out their solution, but at least in the context of transparency, they've published the cryptography specification, the Bluetooth specification deployed, and of course, what do you call it? Other specifications with respect to how other apps are built on top of their protocol. Now, when we look at, let's say, the Arogya Setu app itself, they talk about the fact that none of the privacy policy and terms of service of the app apply to what is known as anonymized and aggregated data sets, which will be used for the purpose of heat maps and aggregate analysis of the spread of the disease. Now, the issue with this is twofold. One is the fact that there is no publication of the anonymization specification. So, alternatively, the Singapore app has gone in grave detail to say, look, we've only collected the phone number of people on one instance, and that is also stored, I think, locally on people's devices. Or even if it's exported, then you create like a masked identifier of the device, and that is then further obfuscated when contact is established between my device and, let's say, Padma's device. Okay. But alternatively, there is no disclosure by the Indian app as to how it's going to anonymize or obfuscate the data, which engenders that we don't really know if the databases or the bits of the app that aren't going that will continue applying even after the purpose of the app has elapsed, whether it is truly anonymized or not. The thing is that when GPS trails of people are collected, it becomes a lot harder to anonymize. And what that means is it's a lot more vulnerable to information security risks like re-identification. And also, anonymization in general can be an easy get out of jail card for a lot of authorities to be able to do like subsequent analysis of these systems. uh, 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 Ideally, there should also be like a time component to all of this, which is that there is an open disclosure that these systems that we are creating, which where data is collected from people's devices and exported to a centralized server, is going to be eventually deleted and destroyed and not linked with other government databases. Because when that happens, there are risks that this will become like a permanent system of surveillance. Now, this, and we can trace back to India's own experience with Aadhaar as to how it slowly became transported or seeded as a part of other larger databases as well. And when it becomes enmeshed, it just becomes a lot harder to disentangle and destroy the database itself at a technological level. Now, and we already have read reports that the centralized server that is exporting people's personal identifiable information. By the way, there are lots of data points collected of people and exported, but that's being integrated with at least 2 or 3 government databases already. So that conveys a certain risk that this might become like a more permanent sort of infrastructure or system that may be repurposed towards longer term healthcare responses rather than being just restricted to the coronavirus itself. We've already seen, even globally speaking, when 9/11 happened, there was a lot of political capital to be able to build out large systems to fight, let's say, the war on terror. Similarly, now globally, there is a lot of basically again political capital across governments across the world to be able to justify the creation of these systems. And that is where the safeguards such as adherence to rule of law, limits of the entire process and the infrastructure every step of the way, and transparency are, there's a heightened onus on the government to adhere to these principles. Unfortunately, in India, given that there is no adherence with any of those principles, and also, by the way, the application collects both GPS trails and Bluetooth rather than other systems which are either going down solely the Bluetooth path, or in the case of one MIT solution, solely the GPS path, where the GPS, by the way, is not exported at all to an external server. That shows that India is also at a design level of the technology itself diverging from international approaches, which are trying to still preserve some modicum of privacy. Now, to what extent those efforts in themselves are compliant with human rights and civil rights, that is another question altogether. But I'm saying that even at a baseline level, India's Arogya Setu app and many state level apps are fairly far away from those minimum thresholds as well.
I would actually like to start taking some questions from people. There's a question here from Ankush who asks, Arogya Setu app feels like another branch for power consolidation through surveillance. I read a news report where a person has been refused medicine because he didn't have the app on his phone. Your thoughts on this? Dr. Sonali, would you?
So yeah, I saw this, I think it was on Twitter, somebody had uploaded a video, and apparently the person was going to inside some gated colony where there were shops, and the guard stopped him and said, you either need a fitness certificate or you need to download the app, then only we can let you enter, you know. So in India, I'm going to be a little controversial here. When we are asked to, you know, light candles on a balcony, we go out on the street with mashals in our hand, right? So that's what the janta is. So we will take it to the next step, and people will use it in all sorts of ways where even the makers of it did not intend it to be used like that. And it's going to become a gatekeeping app. I'm hearing talk of it being, I don't know if it's just rumors, that if you want to enter the metro eventually or get on a bus, you might need it. This is highly problematic, and I'm viewing it through an equity and gender lens. If even if we compare it with Aadhaar still has major issues. Maternity benefits do not reach women because they don't have Aadhaar, or there are inconsistencies about for one of the schemes, maternal health schemes, small amount of 5,000, 6,000 rupees, about 60% women didn't end up receiving it in one of the studies. So we just from a gatekeeping aspect, this can be really problematic. People cannot be coerced into downloading the app. I'll give a parallel example with the Aadhaar. Even when it was not mandatory to link it with your mobile phone, mobile providers still continued saying that if you give your Aadhaar, 2 ghante mein ho jayega, right? We will do it in 2 hours if you give your Aadhaar, otherwise it'll take 2 days, right? So this is coercion. And this will happen, and this will be rampant, and there will be different forms of it, which we can't even imagine right now.
Another question from Anukriti Garg. She asks, has South Korea got their contact tracing app right? Or are there issues with their application? And then she asks, is it possible to get disease-related surveillance right? I'm assuming using apps. So yeah. Siddharth, you want to take that?
Yeah, I will. So with respect to South Korea, it's actually using a fairly complex surveillance architecture, including a contact tracing app. And there's a lot of like 360-degree surveillance which is going on in South Korea, where it's being linked with people's movements, their credit card transaction histories, and so on and so forth, to be able to tell if people at risk are traveling within communities. And there have been critiques of the fact that their effort has not really been consistent with the necessity and proportionality restrictions. And of course, there are many privacy risks with the South Korean approach. The thing is that and I'll refer back to a previous answer of mine, when a country like, let's say, India looks at the South Korean response, they'll just look at the fact that, oh, their outcome was positive in terms of containment of the disease. So then it'll look at the 4 or 5 steps that have been deployed and try and replicate as many. To what extent the surveillance has actually been useful in South Korea is debatable. And then on top of that, South Korean authorities have admitted that citizens have in fact been trolled as a result of government information collection and dissemination activities in a very targeted manner on social media. So then they have appreciated the fact that maybe they need to start refining the way that they collect information and share it with people. That is essentially emblematic of the fact that before governments deploy technology in a situation like a global pandemic, um, uh, they aren't able to build in those requisite safeguards. So, for instance, the harm is already done with someone who's been viciously harassed or trolled online, right? And then it'll just be juxtaposed on a very like crude or rudimentary cost benefit analysis. Oh, but we need to respond to this public health crisis. What does it matter if some people get trolled, right? But that's not how the rule of law functions. And ideally, we should have an ex-ante legal system that can hold governments accountable. So I would not say that the South Korean model vis-a-vis the deployment of information communication technologies is something that we should replicate. Could you repeat the second part of the question? If I haven't answered it, I'll refer back to it.
I think it's fine. I think you got it.
Okay,
No,
fine.
yeah. The other question that we have, and it's more a comment plus question. It's a Gyan says people should not be able to choose between privacy and health. It is sad that the government continues to push for an application which is clearly aimed at surveilling masses and is now gearing up for a wearable tracker. What is the way out? He is asking. Srinivas, what is the way
Um,
out?
the way out is simple. You have to ask them to follow their own rules. It's just like it's not just about privacy and health, right? I mean, even for healthcare professionals, it's about their own security. Doctors and nurses, them not having PPEs, them being hit by cops when they're out on the street, when they're going to do their duties to ensure everybody is safe. Uh, Privacy, just like all other forms of requirements, is as important because uh, the people who are reacting to this crisis are not reacting or not even thinking about any of these issues. They're just generalizing it. Like anybody out there is has no reason to be out there. We want everybody's data because everybody could be a coronavirus carrier. Well, the fact remains that is you have to test unless people are demanding that, unless we are continuously talking about these issues. And if we are simply going out and switching off lines, lighting candles, or banging our plates, unfortunately, things are not going to change this way. We have to demand, we have to actually go to court. I haven't seen a single complaint in the court on this matter. It's important, like even the courts are a manifestation of people, right? So unless people start demanding it, you don't get it. We have a good privacy law. It's a fundamental right. I'm sorry, not a law. It's good privacy judgment, which made it a fundamental right. uh, but in 3 years we don't even have a single order, single judgment using it, and unless people demand it, again courts or authorities don't act.
Yeah. Pratik asks, is there any evidence to back up whether the use of Bluetooth Low Energy or GPS is actually effective for contact tracing? And a follow-up question, how much accuracy should we expect from algorithmic screening that claim to determine whether someone is at risk or not? Either of you, any of you can take this question.
I'm happy to answer that. Dr. Sonali, why don't you go ahead and then I'll answer.
No, I was pointing to you, and then I'll chip in after you're done.
Sure. So with respect to when an algorithm makes a decision as to whether a person is at risk of exposure to the virus or not, the terms of service and the privacy policy of the Arogya Setu app are fairly revealing. Okay. So with respect to the fact that it warns users that please don't uh, leave your device at home or exchange your device with someone in your household, because there is a risk that because of that you may falsely be flagged as COVID-19 positive. So that means that instead of the fact that people are being deemed to be COVID-19 positive owing to a medical test, it may be so that an algorithm is determining if someone has tested positive for the virus or not. That is deeply dangerous given the fact that now the app itself is being repurposed, as Dr. Sonali was referencing, towards becoming an e-pass system for moving around within across like public transportation systems and so on. What and on top of that, given that there is no transparency with respect to how the algorithm or the application is making its decisions, that adds another layer of opacity and is something that is difficult for the public to scrutinize, and is can be argued is a bad faith decision by the government to not put forth what are the grounds for decision making by the app itself. So that's one. The first part of the question, if you could repeat, I'll just address that.
Is there any evidence to back up whether the use of Bluetooth Low Energy or GPS is actually effective for contact tracing?
Yeah, so with respect to Bluetooth, there is, as I had mentioned earlier during this conversation, contact tracing, even using Bluetooth, remains an experimental technology. But there are technologists which say that at least this is a privacy respecting technology which is more accurate than, let's say, location tower based data, and also more accurate than or more reliable than GPS level data. But at the same time, there is already literature that was published, and I'll share it in the chat, which talks about the fact that even with respect to Bluetooth, there are issues with respect to the accuracy of the data based on very minor details. So its effectiveness at this stage remains something which is uh, undeterminable even amongst the technologist community. I think Srinivas could also provide a little bit of texture with respect to the accuracy of Bluetooth beacons, I suppose.
Yeah.
Well, it's an experiment and we don't have the results. If it fails, you would know. If it succeeds, you'd still know. But either way, without tests, it's useless. And without the healthcare response, without the doctors, without any of them, we can't eat data. Also, we need food. That's also not happening. So all we're doing is collecting a lot of data, not reacting to actual issues on the ground.
Dr.
I'm
Sonali,
gonna,
do you
yeah, I'm going to chip in there, and I think that was a very, very important point brought up by Siddharth and Srinivas. So, data without action is of no sense. So, if it's not translating into public health action, and we are collecting vast amounts of data, doesn't make sense. Okay, so I have not downloaded the app, and I'm not going to download it. And I've told my family not to download it. What is my main concern? My mother is hypertensive and she's obese, and she's in reasonably good health. Now, hypertension and obesity are serious risk factors. They are known to exacerbate the illness if you catch it, right? And there have been cases of 1 or 2 cases which have been reported in the news of people who have died while in quarantine because of coexisting morbidities, not because of being COVID positive, but they've been in quarantine, their diabetes hasn't been attended to, the hypertension hasn't been attended to, and they've actually died, right? And I hope there is some legal framework for addressing this negligence. So I'm very worried that if somebody in the family downloads this app and I don't understand the technology behind it, some policeman shows up at the door and says, we need to put you in institutional quarantine. Now let's contrast this with contact tracing. So let us not think that an app is equal to contact tracing. It is not. It may be a data source for a small, very small piece of contact tracing. It is not contact tracing. When you imagine contact tracing, imagine people, a group of 3-4 people ringing doorbells with a clipboard or maybe some small digital data entry, but probably paper and clipboards, and taking forms and asking a few basic questions. So now contrast a digital thing in which a policeman shows up and takes somebody for quarantine with a team of 3-4 people, including maybe somebody from that area or that building, saying that your neighbor has tested positive. We are concerned about your health. Can you tell us if you've interacted with them? Or you have a common gardener with somebody, so you need to stay at home for 14 days. Very, very different interactions, very different in terms of fear, in terms of trust, in terms of cooperation, right? In the second situation, my mother might even say that, look, I have 2 maids, you need to test them out, right? Versus an app-based thing. Let's take the story of what happened. I'm forgetting the place. Maybe it was Indore, where the health workers who were doing contact tracing or door-to-door surveys were attacked. So what happened? They went back, right? We forget the ending of the story, right? They were mistreated by the community. It was wrong. There was misunderstanding. There is a pervasive lack of trust and fear in society, including me, who's a public health person, who is well informed. I still have mistrust. So imagine people who don't know, who are thinking this is some kind of a dangerous disease. and they don't know that 80% people have no problem at all, cough, cold, fever, fine. And then they are concerned that health workers will show up and they'll seal the place. Plus, you don't know what's circulating on WhatsApp. But nobody talks about that the workers still went again the next day, they counseled, they reassured, and they continued with contact tracing, right? Now, will this community download an app? No, they won't. What we need is an army, and Anand Pan and others in public health have written articles on this. We need an army of boots on the ground contact tracers. Where are the government ads for this? Where are forecasts? Where is, if you want to use technology, if you want to use data, I want to see data on number of contact tracers in every district in India. What are the gaps? I want to see HR notices for hiring, and not 60-day hiring contracts. So there are contracts which have been issued, ads which have come out for epidemiologists, public health people, which are short-term contracts, right? COVID is not going away. Public health issues are not going away. 200,000 people are dying of tuberculosis every year. We need manpower on the ground. And we can do it because India does massive surveys. We do these family health, annual health surveys, family health surveys. We survey lakhs of people. A country in which the central government has the ambition to check the citizenship of every person, right? Are they doing it through an app? They're going to do it through door-to-door information through the NRC. I don't know what is the difference, but yeah. And here we are relying on things like apps for contact tracing, whereas we need boots on the ground, people, training, scaling up, forecasting. We're just repeating the same data again and again, number of cases, number recovered, number active. We are not talking about less techy things like oxygen. Where's the conversation on oxygen? More people are going to need oxygen than ventilators. And giving me an app is not going to solve my mistrust of poor quarantine facilities. It's not going to help build trust between the provider and the patient, because patient is afraid of bad quarantine facilities, is given no information. We get so many SOS calls of people who are in quarantine and have not been told their test results, or families are not informed, right? And these stories go out into the public, and they're happening. So you asked me about the fundamental nature of the provider-patient relationship. What has not changed is the concern of providers for patients. They are pained that they are not able to do more for patients. They are pained, multiple clinicians, senior clinicians, almost heads of departments, are like, we see patients being shuffled from one hospital to another for either they are suspected COVID, or they don't know where to go, so they are sent from one hospital to another. And they are literally pained by this, but they do not have a solution for this. We are working on apps, but right now, give me one website where I have an updated list of COVID designated, non-COVID designated, public and private hospitals, laboratory testing facilities, and maternity care, and OPD timings, which have changed. Do we have a listing of that? We need simple information which can be on a website to be out there, because not having this information increases risk of contracting the disease. So if one pregnant woman has to go to 5 hospitals, let's suppose there's a bad scenario in which she turns out to be COVID positive, 5 healthcare teams across tertiary care hospitals will have been exposed to COVID. Right? So we need to think simple, basic, strengthen it, and have forecasting, and move from there. I think just something like Arogya Setu is distracting from the main purpose, just like hydroxychloroquine and BCG, right?
Thank you. I think I'll take a few more questions before we sort of wrap this up. Sai Darshini says, even if the Personal Data Protection Bill 2019 had been in place, the governmental exemptions under the current version would have rendered a broad, easy scope for Arogya Setu with lesser privacy adherence. In such a scenario, what alternatives do we have apart from expecting governmental accountability?
Well, the data protection bill is, of course, not great. Ideally, what you need is a data protection bill that also administers surveillance reform in line with the Puttaswamy threshold. Given that that is the case, ideally, there's an onus on the Joint Parliamentary Committee to be able to embed those safeguards into the current data protection bill. The hope is that if there is enough political discourse on the fact that the data protection bill should have these safeguards, maybe that can nudge the parliamentary committee to recommend the central government to at least have some system of checks and balances uh, within our surveillance laws, because right now our frameworks under both the Telegraph Act and the Information Technology Act are not compliant with the Puttaswamy standard, so to speak. So that is one way to look at it.
Okay. We have a question from Monish who asks, what should be the impact of current Arogya Setu on India health stack? Srinivas or Siddharth?
Okay. So it's important that we understand what India health stack is. And we are in this crisis, and this is not necessarily a healthcare crisis alone. We are seeing every institution is crumbling, right? I mean, if you're looking at welfare state in terms of providing food for all the migrants and people who are out of jobs, who can't access food. Forget healthcare, because there might be a scenario where more people will die out of hunger. Now, the rise of stacks in India happened with welfare. The whole idea of welfare state, and that the market will take over the functions of the welfare state, which is essentially we will build systems to tell you who should get food, who should get pensions, who should get healthcare. Okay, so this is a very neoliberalistic idea of that the market will solve everything. The state, it's essentially free market, will decide things based on demand, and they will match the supply. The state should not worry about these things and let the market innovate. And this process started with Aadhaar. You have Aadhaar in 2009, and then Mr. Nilekani goes on and writes something called the Technology Advisory Groups Report, which actually recommends building of something called the National Information Utilities, of which Aadhaar was one. If you look at it, Aadhaar is a giant database of information. Then they built more of these. They built the UPI, then they built e-sign, eKYC, whatnot. Now there is a push to build the second or the third phase of it, which is the health stack. Then there is the urban stack for smart cities. Then there is the skill stacks for skilling, so that you skill migrant laborers and you try to place them. Essentially, what's happening here is that you are privatizing government functions, and it's being built by the private sector. These are the same people who built Aadhaar, who have built Arogya Setu. If you look at the people and their associations, you will see that there is a lobby group who is pushing, who is using crisis scenarios, whether it's demonetization, whether it was the Bombay attacks in 2008 to push Aadhaar, to push surveillance. Okay, uh, the whole coronavirus pandemic is a giant crisis, and crises mean that people are looking for solutions, any solutions.
Yeah.
And you have these people who are posing as the guys who can solve everything. You know what? I am the god because I have money. I have a lot of money. I can probably remake human mind, create an AI to do it. If you ask a healthcare professional, he'll tell you how complex the human brain works. But to the businessmen, it's a great place to invest money in, because people want to live even after they die. So India Health Stack, Arogya Setu, Aadhaar, any of this is essentially the free market trying to fool you and essentially taking over government. And we see that the government has no clue what to do except to listen to them. You must read Chomsky and Naomi Klein. Naomi Klein has a book called Disaster Shock Doctrine, where she talks about disaster capitalism.
Yeah.
Health stack is actually that. You have a disaster and you have a set of startups and people whose economy is bust, who now want to make money on top of this ongoing crisis, and who see this as a good experiment to play out their ideas.
We have a question from Vish. How do we know if companies such as Cambridge Analytica may not step in and use our data points to influence our votes in future elections? Wow.
That's an interesting question. And so the Internet Freedom Foundation has developed a fairly comprehensive working paper, which I'll share later on, like privacy issues with respect to technology deployments during COVID-19. And one of the things that we've sort of examined in some amount of detail is the fact that this particular public health crisis creates an opportunity for private sector solutions which are reliant on sort of surveillance models or surveillance capitalism. That's a term that's been popularized by Shoshana Zuboff. Very good book. I recommend people check it out. Uh, Basically, the public health crisis can be a justification for not just the government, but for private actors to be able to model or create certain solutions which would otherwise not be palatable to the public, but now it can be marketed as something that is necessary in these current heightened times, so to speak. It's known as a phenomenon which we describe as reputation laundering. And already what we've seen is that, for instance, the NSO group, which was deep intrinsically connected with a data breach through WhatsApp last year through a software called Pegasus, which actually adversely implicated several civil society activists and lawyers in India as well. They are right now building a contact tracing sort of solution which they're pitching to governments to use. Similarly, Palantir, another big data company which typically works with law enforcement agencies, they're also creating certain solutions for, let's say, the UK government to look at. So already we're seeing that a lot of these sort of companies are coming out with, they market it as civilian technologies that they can push to government to use, and as a backend they'll get access, or they'll at least have be providing the systems itself in which the data is collected and analyzed by the government. Now, how they use it further is a function of, ideally there should be a legal framework that regulates that interaction or actually prohibits that interaction. But in the absence of it, it'll be based on a back-end contract between government and the vendor, which could be an NSO group or a Palantir. And that is completely in the dark or in the shadows, right? And that creates certain privacy risks, I would say.
There is a term for this, okay? When you have actual surveillance companies, companies which build surveillance systems, building corona apps, contact tracing apps. It's called corona washing, like whitewashing, when essentially you have a white man coming over to Asia and Africa saying, oh, you don't know what freedom is, let me give you that by taking over control of your systems. It's essentially that.
I
Corona.
suppose our usage of the term reputation laundering is a play on that itself.
Yeah. I think there are two more questions and we'll sort of close this. Apple and Google are planning to incorporate contact tracing into their respective operating systems. Will it improve the situation combined with data protection bill? Asked Dushyant.
No, what you need is a vaccine. You don't need an apple, you need a vaccine.
Yeah, and our working paper sort of goes into the different types of structural risks that come about with respect to competition for one at the level of the fact that they operate the app store, and what about like other solutions which are also building similar apps? There is a risk of conflict of interest. Then we also talk about the fact that they want to be working with public health authorities, but then how can they hold governments accountable to ensure that that data is not further accessed, let's say by law enforcement or police and so on and so forth? So how can, and then we also in our working paper, and I'll just link it in fact just after this answer, is the fact that isn't there a risk of a purely private or a corporate entity administering a pure such a crucial platform responding to the public health crisis? We speculate that maybe a purely corporate entity is not the right way to even conceptualize such a framework, and at the very least a public private partnership is considered if they are deployed at all. So we've flagged a few questions that I think we need to have a deeper conversation on, and we've also flagged risks of surveillance capitalism and so on.
Sure. One final question, and this is from Johan. He asks, are there any civil society options here that can scale and compete with government options like Arogya Setu? For example, an effort to develop a contact tracing framework using open source technology developed by civil society. Basically, is there anything each of us can do at such a time?
Okay, so we actually need a lot of ventilators. We actually need a lot of actual healthcare solutions in hospitals, right? But these systems are complex. Doctors and biomedical practitioners, engineers who are trained to develop these systems. I mean, I agree it's not rocket science, but it's still complex. These are age-old systems which we already have developed. Like ventilators are nothing that you need to reinvent. We know how it functions, but the issue is we are unable to produce them because we never had the manufacturing setup in the country. While we do have a lot of pharma setup and all of this, uh, which brings to the question of whether building an open source system, an alternative whether software can solve any of this. No, you actually need systems in the hospitals which are like mostly hardware. It's care. You actually need humans. You actually need tools which can assist those humans. So I have this joke or the statement which I've been making for a while now. It's that if you can solve the coronavirus pandemic with an app, I'm happy to do a open heart surgery with a screwdriver. Okay, it is like if you don't equip our doctors and nurses with the right set of tools, with beds, ventilators, PPEs, and masks, whatever they need, and you're instead focusing on something that's unnecessary, you're just wasting time. I would say let's step back. And there's a lot of discussion right now across the world, which is saying that why are we letting the tech bros, Silicon Valley bros, lead all of these discussions instead of having doctors like Sonali take the lead? Why is it that suddenly that you will have to listen to everyone saying that, or even like the Niti Aayog's head saying that in 13 days we were able to get the highest number of app installs in the world, when our contact tracing or tests for coronavirus are the lowest in the world, right? So it doesn't help.
Yeah. Yeah, thank you so much to all the speakers who joined us today. To each one of you, in short, would you like to leave us with some more thoughts, some more, anything else that you would like to end this session with today? Dr. Sonali, will go with you.
I think what Srinivas said was very, very pertinent, and we have to do the basics. We cannot solve a failure of communication and community engagement with an app. We need, and can we be creative? Can we have an app which actually reduces stigma? Can we have an app which actually increases privacy? Can we work on that instead of getting into a situation where we are worsening personal liberties? Pandemics will come to an end. This will come to an end. All pandemics have come to an end. But if we are we willing to risk our liberties, which we may not regain? And that needs to be thought about. Yeah, thank you.
Siddharth, final thoughts.
So yeah, so I would say that, and I'll keep it short, right? I think there is an onus on the government of India to show some amount of good faith that, in fact, this project is being done with good faith. If that were the case, they need to be able to demonstrate that this will not lead to a permanent system of surveillance, or this will not lead to a risk of a new large database which can be linked with other large databases for future analysis. So, for instance, what it's right now doing vis-a-vis the government committee itself to try and expand the capabilities of the Arogya Setu app, probably in the form of, let's say, a platform, or for that matter, when there are these soft nudges towards private sector actors to ensure that their workforce are installing the app. All of that shows that, in fact, there is no conformity with conceptions of, let's say, informed consent, meaningful consent, or voluntary adoption of an application. Let's say in a perfect world, we did have a technological system that actually aided with the public health response. That interaction between the technology and the citizen should be restricted to just them interacting with their device, where the government doesn't intermediate or take control of that interaction between citizen and technology. It's when it intermediates or tries to regulate that interaction is when risks of surveillance take place. Contact tracing should ideally be, see, government has enough data when it comes to even based on existing capabilities to know at least broadly what are, the risk areas where more testing is required, and so on and so forth. The contact tracing solution in an ideal world should be able to tell me as a citizen the answer to a very basic question: where I'm situated, where I'm moving around, is it safe or not, or am I unsafe? That interaction should be just between me and my technology or my device, let's say. But when it's when those interactions are then being exported to an external server, there are concerns that the government may want to use it for other purposes as well. And that's where there's a heightened onus for the government to act in a good faith manner to reassure the citizens that it won't be abused, or that we will restrict it to this purpose and eventually delete it. Or because a democratic society is more than just, what the majority wants, but it has to also be an appreciation that there are certain risks that may accrue to either individual civil liberties or minority groups, and so on and so forth. So therefore, those safeguards have to be built in right at the outset, which it hasn't done now. So there's a need for immediate course correction, essentially.
Okay. Srinivas, last thoughts, final thoughts on this.
I mean, I have a lot to say. I guess I'll just say listen to my podcast, maybe. But no, on that note, like read a lot, call out all of this stuff. I mean, unless people ask for accountability, you're not going to get it. It's
Yeah.
simple. You are in that ecosystem. Unless people actively demand that, nothing's going to change. The problem is if we are actually silent, and when people talk about Arogya Setu and all of this, they're actually more worried about the future than the current present, right? It's not just what's happening right now. It's like whether this is going to become the norm is what most people are afraid of, and you need to start demanding things.
Yeah. Thank you so much. So, to all those who are still here, we will be converting this into a podcast, maybe into two parts, and we will be releasing this on a Cyber Democracy podcast. Cyber Democracy is available on sunoindia.in and also on all podcasting apps. The whole idea behind Cyber Democracy actually came because I realized just from talking to my peers and to my family that there was a lot of information gaps in our understanding about what does privacy mean, what does the government do with all this data that it collects? Why is it pushing Aadhaar onto us? And so that's how cyber democracy, thanks to Srinivas, came to life. And we have actually released an interesting episode on Arogya Setu. It's already up on the podcast. So please go ahead and listen to it. And we will let you know once these episodes are out too. So thank you, and subscribe to our newsletter, sunoindia.in, and also make sure that you subscribe to Internet Freedom Foundation's newsletter. Thank you, guys.
And I'm ending the session.